Hello, my name is Emerson Thomas, and I am here with my colleagues Kara Martinez and Vivian Lee, and our presentation is about alternate treatments of dissociative identity disorder, known as DID. The problem that we face is that there is no specific treatment for dissociative identity disorder so far. In the medical community, it is treated like schizophrenia, which means that they use the same medications for schizophrenia also for DID patients, which we believe is incorrect. The disorders stem from different sources. For example, schizophrenia is a genetic disorder, which means that it is passed down through generations, while DID is actually a trauma-based disorder, which means that some sort of trauma or abuse occurred in the person's usually young childhood, and therefore the disorder is manifesting itself in adulthood. Our goal is to find a more appropriate treatment without medication and preferably just with therapy. Based on many studies, dissociative identity disorder is neither neurological or psychological. Similarly, researchers have also discovered that it is not fantasy-based either. This backs up the belief that traumatizing childhood events and abuse can cause a smaller and misshapen hippocampus. Researchers have scanned the brains of DID patients with PET scans and MRI scans, and it has been discovered that PTSD and DID have similar brain scans. Although schizophrenia medications are widely used to help DID patients, we believe that this is incorrect because the disorders are not similar to each other based on how they originate, and we believe that PTSD and DID patients are more similarly linked. Therefore, we can use the same therapy we use for PTSD patients to use on DID patients.
Our goal is to explore the causes of DID and explore possible methods of treatment. We also want to prove medication is not necessary in the treatment of DID. To accomplish our goal, we will be conducting our own clinical study. The significance of our research is the elimination of unnecessary medication, the elimination of dependencies to these medications. It is also very important for DID patients and their families to know that there possibly could be a non-medication based route of treatment, and this research will also give a better understanding to a widely misunderstood disorder. Our research question is, can DID be treated with medication alone? Our hypothesis is, if DID is trauma-based, then therapy will be effective in treating the symptoms. Our methodology is, we will be doing a study of DID patients. We will be studying 3 different groups. Each group will have 20 participants. Our first group will be a control group receiving medication. The medication will be an antipsychotic and an anti-anxiety medication. Our second group will be receiving both medication and therapy. Our third group will be receiving medication or a placebo and therapy. We will be using exposure therapy, which is a type of therapy that places the patient in front of their fear without the danger being present so that they can overcome their anxiety. We will be comparing magnetic resonance imaging and positron emission tomography scans at 20 weeks and at 52 weeks for the patients. The criteria of the patients, they must not be previously treated or diagnosed. They will be aged 18 to 45, and the study is open to both male and female. We will be using questionnaires to diagnose our own patients so that none of the study is affected by any previous treatment.
To conduct this experiment in a safe manner, we'll be following the code of ethics provided in the Belmont Report, which are respect for persons, beneficence, and justice. As the leading researchers, we will be informing all the participants with what medications they'll be taking and what type of treatment they'll be going under. They will be told beforehand that they'll be taking 30 milligrams of the mirtazapine and 5 milligrams of risperidone, which is the antipsychotic and the antidepressant. Also, for the beneficence, to minimize the risk, we will be giving each 2 questionnaires, one questionnaire to measure their capability of their mental health. So it's to help us determine whether they are able to go through with this experiment safely. The other questionnaire is a questionnaire that determines whether they actually have DID or they don't. This is an example of part of a dissociative identity disorder questionnaire. As you can see, there's questions like, some people have the experience of driving a car and suddenly realizing that they don't remember, and you always put an average. And what they do is they'll take off these zeros. So you have like 10 would be 1, 20 would be 2, and then you add them all up. So the higher you are, the more of a chance you have identity disorder. Towards maximizing the benefits, we do feel that the benefits do outweigh the risks, because if successful, then the unneeded medications that are given to the patients with DID will no longer be needed. Instead, they'll be going through therapy. Towards the justice, it's justifiable because our goal is to find an effective treatment for dissociative identity disorder. So even though there are risks, if it is successful, we feel that our goal of finding it will help serve a purpose to everyone that has DID. Towards the impact of our research, for the scholars, it would help create a basis for our new research. So for example, if another student or another professor wants to go more into this specific topic, as in think of another therapy that might work, then we will already have background information towards this subject, and we'll already have data from one type of therapy, and they could compare and contrast. Towards the communities and the society at large, they're both around the same. Towards the community that do not know much about DID, they'll be given more information about exactly what DID is, how it's different from schizophrenia, and how you should treat it correctly. For the community that has DID, it'll give them a way of treating their disorder without the use of the drugs originally from schizophrenia or any prescribed medication. So